You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic. He says no more dentures. Get a fixed set of teeth in just a few appointments. Oral surgeon, Dr. Wallace. Dr. Wallace, welcome to the program.
Thank you, Randy.
All right, now before we get into today's topic,
Certainly.
Tell me a little bit about your practice. I mean, what are the different procedures you do as an oral surgeon?
Well, I see a wide spectrum of patients. So one of the bigger procedures we do is we do reconstructive jaw surgery. We may correct a bite that from some growth disturbance.
All right.
Maybe one jaw grows bigger than the other.
So the hospital sends you...
Hospital will send me...
Somebody's in an accident?
Somebody's in an accident, previous trauma that needs to be corrected, or the bite's off because of that. Or some kids just don't grow the same. So you've got somebody with a lower jaw that's too big or too small.
All right. Okay.
So we correct those facial proportions with larger procedures like that. The biggest growing part of our practice is dental implants. Now, the amazing thing about implants is it has become this huge revolution in dentistry. It is probably the most important thing in dentistry since it started.
Why?
Implants have changed the world of dentistry for one simple thing. They can take a denture and hold it in place.
Okay.
You can put in 2 implants just in the lower jaw and have a denture that was a struggle to maintain. Couldn't laugh, eat, talk without worrying about it coming out. Now it stays in place.
So all dentures in the future will just be fixed onto something?
Yes.
Either snap in, snap out, or permanent?
There's no reason why not to.
So tell me a little bit about your background and training. And you also do a lot of volunteer work.
Certainly.
Which is very nice.
Well, coming out of college, I quite frankly didn't know what I wanted to do.
Okay.
I was born in Austin. Both my parents were school teachers, so I knew that education was important, but really didn't have a lot of direction until I finished college. Spent time with my family dentist, Dr. Jones. He's still there in Houston.
Is that right? Okay.
Absolutely. He then introduced me to his oral surgeon. Spent some time with him and watched one of these bigger jaw reconstructive cases in the hospital before I went to dental school. I saw that, and then I was amazed. I was like, this is the coolest thing ever.
Really?
So I was hooked. So
you don't look like a dentist, by the way, or an oral surgeon, right?
Is that a compliment?
Maybe it is. I don't know. I never know what to expect when I'm going to meet them.
Right.
Because, I mean, people don't like going to the dentist, right? I mean, especially the oral surgeon. I mean, do you hear that where they say, no offense?
I don't like going to the dentist.
Okay.
Quite frankly, I don't like oral surgeons because it's usually associated with 2 very poor stimuli, pain or fear. And they may be the same thing for some people. So, I mean, there's a good reason why people don't like to go to the dentist.
And dental implants don't hurt, you say? I mean, it's not something they complain about.
You know what? Once they've had them, I do a procedure and place a dental implant, no, there's almost no pain associated.
Because the bone has no feeling?
The bone has no nerve endings. A tooth hurts because it has nerve endings around it.
Okay.
When I take out the tooth, the nerve endings go away.
Now, are you one of these guys that believes, or secretly maybe, that the oral surgeon is the one that should be doing the surgery if you're going to get dental implants?
I think it's very important that you seek somebody that is always focused in that area.
So tell me this though, researching this, that what used to take you guys when it came to dental implants, 9 months or 12 months, now can happen in just a few visits.
Right.
Why is it so quick now?
Well, here's the change. Okay, so in the old world, we'll call that, the old world of implant dentistry, we were very worried about if it would work or not. So you had to take out the tooth and let it heal up completely.
And put in the implant?
Wait 3 months, then put in the implant. And they wait 6 or 12 months. Now you're a year and a half down the road. Now you can go in and test the implant and start putting the stuff on top of it to make it look like a tooth. You could be a year to 2 into the process here. Okay. But what has changed is several things. Number one, the implant themselves have improved since the 70s and the 80s. I mean, you bought a Honda Civic in 1970, they were making them then. Okay. But what's a Honda Civic car now? I mean, it's the best engineered thing on 4 wheels at that price. I mean, it's a great piece of machinery. The implants have done the same thing. So the implants are a better design. There's a microscopic structure that helps attach bone to it. It's almost like a magnet. Okay. And that's new. The second thing that's really important is the imaging capabilities we have in our office. In our office, we have the ability to make a 3D image of your jawbone or wherever we're looking to place an implant. I mean, its accuracy down to 1/100th of a millimeter. That's 1/10 of a human hair.
What are the categories? And I know you brought models.
Sure.
But what are the different categories of dental implant patients that you see?
Well, it breaks down into 3 basic categories. Okay? The first category is going to be the patient who's missing 1 tooth. Okay? So you've got 1 tooth that's missing. The second category is going to be a small area. Let's say there's 3 or 4 teeth in a row that are missing.
All right.
And the third category, and probably the fastest growing category that we see in our office, are the people that are missing all the teeth. So they may be missing all of the top teeth or all the bottom teeth or both. If they're missing all the teeth in either jaw or both, that puts them in the category where now they're thinking about dentures. Okay? That's where implants come in. They've been wearing dentures. Okay? Now let's say they've been wearing dentures for 10 years or less. Now those folks usually have a little bit more knowledge about the procedure, and they know that implants are a possibility, and they are. Start with this simple 2 on the bottom to hold in the lower denture, which is usually the biggest pain in the butt. Okay, up to 4, put in and never have to wear a denture again. Just the teeth secure to the implants.
So a fixed set of teeth with just 4 implants?
Yes.
Interesting. Now you say people's literally, and I always, respectfully think that you're exaggerating, but you say you're changing people's lives.
Yes.
With
it's amazing.
dental implants.
It really is.
Elaborate on that.
Take somebody who is a complete dental cripple.
Okay.
No functional teeth, they're wearing dentures, they probably only use them when they go out to the store and they take them out as soon as they get home. This is the one thing that's changing people's lives from our standpoint. This is the game changer in dentistry. So as they can walk in with dentures, I can place 4 implants, maybe a few more, attach the teeth to it, and they go home and they'll use them that day. It's amazing. So let me share a little story with you.
Okay.
This is Susan, okay? Susan actually started to lose her teeth due to gum disease at a fairly early age.
All right.
She was wearing a full denture on the top and a partial denture on the bottom in her 30s, and that is way too young.
Yeah.
That's too young for anybody. I mean, everybody's too young to have a denture.
Is that common though? I mean, 40-year-olds, 50-year-olds
Yes.
having full dentures?
It is.
What's the oldest, by the way?
Oldest denture?
Oldest that are getting dental implants.
98.
Why would a 98-year-old want to get dental implants?
For every reason in the world. The same reason you want your teeth.
Okay.
Okay? So, I mean, this patient in particular was 98 years old, and what does she love? What is her favorite thing in the world to do right now? Eat.
Okay.
And she had 5 remaining teeth that she could chew with, and that is really where she is, She's lost a lot of the activities in her life. She's not as mobile. She can't go travel.
At that age, they could still be candidates, though? I mean, the implants will stay in the bone?
Age has nothing to do with the success rate of an implant.
Okay.
I hear it all the time. I hear it from people who are 50. I hear it from people who are 70. I hear it from people who are 90. I'm too old for this, and that is completely untrue. Your bone does not know how old you are.
Okay.
And neither do the implants.
All right.
So they're not going to hold it against you.
Okay. Okay, so this woman, she goes to you, she's wearing a denture, she's in her 40s or
she
late
comes
30s.
to me, and she's been wearing a denture now for almost 20 years. So she's in her early 50s, and over the years she's had to wear more and more denture adhesive, and she starts to develop a very serious problem. Her mouth starts to have a burning sensation all the time.
Really?
She can't, and it helps if she doesn't wear her dentures at all and she doesn't wear any glue in them. But how does she leave the house, or how does she even face her family without her teeth?
Okay.
It's a huge social stigma. So here's what we did. We talked to her about this. Her biggest concern was always having pain. Literally go to work, be able to tolerate wearing her dentures enough to get through the workday, come home, take pain medicine, go sit in a dark room.
Is that common, by the way, with denture wearers? Do they tell you that they have pain?
I do have several patients who have pain that happens from wearing dentures.
Okay. So she had a burning mouth.
Yes.
Did you guys ever figure out what that was all about?
Well, we think it's associated with either the denture cream or the acrylic of the denture.
Okay.
And it happens in a minority of patients, but it does happen, and it's very hard for them to get through the day. So what we did is, yes, we placed 4 implants on the top, we took out the remaining teeth and placed 4 implants on the bottom, and fixed teeth to those implants. And now, there's no denture cream. What happened to her pain?
It's gone.
All went away.
Okay.
She's the happiest
Let's take a look at the after. Let's take a look at the after.
So.
Wow, what's that now? What is that photo?
Now this is pictures of her mouth. This is her.
Okay.
Okay. So she was wearing an upper denture and a lower partial, and you can see without her teeth, she looks so old. She doesn't even recognize herself in the mirror. So afterwards,
that's another photo with.
That's a photo of her without her teeth in.
That's the same woman. Okay.
Same woman. Does not look like somebody in their early 50s. She looks like she's 80 here.
Okay.
But here she is after. I mean, that's amazing. She is a completely different person. She smiles different. She's always in a better mood. Her relationship with her family, with her husband are all better. She never has to take out her teeth anymore. She eats what she wants when she wants.
So how many implants, like for example with her, and I'm looking at that after. In fact, if we could show the before and after side by side.
Yeah, on this
with
one.
no teeth. Very, very nice.
After surgery, she's a different person.
Okay.
I mean, no more pain in her mouth. I mean, her smile is different. Used to be kind of this part-way, halfway smile, and now her smile's huge. I mean, she is ear to ear all the time.
Now that looks like a cosmetic, like veneers.
Yes.
In that after. Okay, so that's the work. I mean, you work as a team with...
I work as a team with my restorative dentist.
Okay.
Okay, so again, I'm not going to be the jack of all trades. I'm going to concentrate on the surgery. Okay. I'm always working in tandem with a restorative cosmetic dentist. Okay. Those are the guys that are in charge. Those are the guys in charge to make me look good. I lay the foundation, I do all the stuff behind the scenes, and they build it and make it look pretty. Absolutely. They did a fantastic job.
Okay, so somebody just tuning in. Dentureware is watching this. Mm-hmm. Four implants on the bottom, mm-hmm. Four on the top, or 6?
4, 5, 6, doesn't matter.
But on her, how many?
4.
4. And she gets a whole fixed set of teeth.
Mm-hmm.
Interesting.
Absolutely.
And what are the misconceptions? I mean, if it's as good, I should ask you this. If it's as good as you say it is, okay? And how many denturewares do you think are in Dallas?
Oh, hundreds of thousands.
100,000, okay.
100,000.
Filling up a stadium of denturewares.
Sure.
If it's so good, why aren't they all doing it? And if you could do it with just 4 dental implants?
Probably because they don't know it exists. I mean, I get people all the time who are wearing dentures. Let's say, and it's usually by happenstance. A lady comes in, her mom's with her. And then it's this side conversation. Well, what can we do about mom's denture? She needs another pair. Well, what about implants? Oh, well, I didn't know they really did that with implants. So it's amazing just being aware that this is a possibility.
You say, you told me in the green room, they don't go to the dentist anymore.
No.
So nobody's telling them to do it.
You're right.
That was a good point.
And this is a bigger problem, is that why aren't they going to the dentist? A, they didn't like their previous experience. They lost a lot of teeth, probably with some traumatic effect. And now, why do they need to go back? Because now they have dentures. So they don't think they need any more care. So they never learn about the newer options.
Interesting.
So this is something that it is amazing. I tell you what, everybody who's done this, not one of them comes back and goes, wow, I should have waited on this one, or I shouldn't have done it at all. The unanimous answer here is, why didn't I do this 10 years ago?
Really? Do they really say that?
Yes.
So 100,000 people just probably around your neighborhood that are wearing dentures, upper or lower.
Or both.
And you say that they don't know that 2 implants could give them something to either snap in or snap out, or get a fixed set with 4.
Very interesting. Most of them don't know.
They can chew? I mean, they can chew anything? I mean, they could, like a steak?
Yes. I mean, yeah. I mean,
how soon can they start eating, by the way? In a perfect situation,
sure.
How soon can
In a perfect situation, I'm going to tell them to go home and start eating that day. We're going to put in 4 implants, we're going to attach the teeth, and they're going to go home and use them that day.
Is that right? How soon can they eat like an apple?
An apple, I usually like to give them a good 4 to 6 months of healing after that. I put them on a soft diet for 2 months.
Because I've seen these, anticipating this. I go on YouTube, people biting apples right after.
Yes.
So it is possible to do that.
You will be able to do that.
Probably not a good idea, right?
Not the first day. It's kind of like, the first day you learn to ride a bike, you're not going to take it off and jump it off a ramp or anything.
Okay, now you brought models. What are we looking at there? And let's go over the options for denturewares.
Okay. Well, let's start with the simplest thing. Now this is, let's say somebody is wearing a denture.
Do you show this to patients in your office?
Absolutely.
Okay.
And this is the great thing about it. If I can get this off.
So, is this accurate? Let me see this. I mean, is this
absolutely
this the way this goes on here? Okay, so this is interesting. Okay, so these little holes underneath here, we show the camera. So and this is a lower denture?
And you hear it snap even.
Interesting. And this is, okay, so that's not a setup here.
I mean, yeah, that's...
Do some people have a tough time pulling it out?
Yes.
From their mouth?
And the funny thing is, we can make them very tight. And in fact, we come back and change out the suspension, so to speak, under this, so it's easier for them to do.
So 2 implants
can help hold in that lower denture.
And they won't have to use adhesive even in the back?
No.
And they can eat like broccoli with that?
What can't they eat?
Really?
Yes.
Okay. We joked about it. You said if there was a try-in period. Elaborate. Tell that story. If there was a try-in period on a Friday for all the denture wearers.
Well, let's say you had that stadium of 100,000 people who wore dentures. And you could magically wave your wand. Because this is what I tell my patients. Magically wave your wand, and we can do whatever you think you need.
Okay.
Or whatever you want. So let's say we can magically put in 2 implants. They're going to attach to your denture that day. Okay. But and it's like the fairy godmother. You get a week of this.
Okay.
Okay? What's going to happen at the end of the week when the implants go away? They are going to realize what they've been missing for the last 10 or 30 years they've been wearing the dentures. They've been putting up with so much. So This is the game changer. Nobody would go back to wearing a denture without the implants.
Is it common, by the way, and I think I've told you, and I've even said it to other people on my show, that my mother at 75 years old said, my medical doctor said I was too old for dental implants, that I don't have enough bone. Is that the perception you think out there with a lot of people?
It is an untrue perception.
Okay.
Okay. Age has nothing to do with the ability to have implants. I hear that from some of the doctors that I talk to. Well, they're X years old. Okay. Well, then if 70 is too old, why are they traveling? They're still enjoying life. They're dating. Okay. You know, look at Match.com.
I mean, 70 is really young today, by the way.
Absolutely. I would say it's more equivocal to 50.
So the next level then up, in addition to the two
Yes, you would add 2 more implants towards the back. And let me pull out that model here. So here's the same denture. This time, you have 4 implants. Okay?
Okay.
It's the same kind of snap in, but now you have a little extra security.
Let's take a look.
Okay?
Okay. We got that. Okay.
Sounds good.
Okay. My hands are a little greasy now, so I think people will think it's a setup. But so they can eat with this. 4 is obviously a little bit better.
Absolutely.
Okay. Snap in, snap out.
Right. Now, here's where things change. These are both removable. 2 implants, 4 implants. Heck, do 3.5 implants. Doesn't really matter. They snap in.
Okay.
But where does this become much more like natural teeth?
When it doesn't come out.
Correct.
Okay.
So how do we do that?
You tell me.
4 implants. It's easy.
Really?
So let's take a look at this.
I've had people, I got to tell you something else. You know,
Okay.
I mean, I've had people that say, Randy, I don't know about 4 implants isn't strong enough to give somebody a fixed set of teeth in their mouth. Now, you're an oral surgeon, okay, so you're the expert.
Right.
Okay, so that's why it's nice to have, you know, it's not like you're a general dentist that took a course. I mean, you're an oral surgeon.
Right.
4 is enough? Really?
It is for many people. Now, when I do this procedure, I don't count implants. Okay? I put in as many implants as it does to make the job.
So 75-year-olds, 70-year-olds can go with this.
Do it
and
4.
You call that all on 4.
We call it all on 4. It's a common name for it.
4 implants on a whole set of teeth.
Fix a whole set of teeth. But if it's a bigger person, I may put in 5. I may put in 6. I don't even change my fees depending on how many implants I put in.
Okay.
Because for me, it's not about the number of implants. It's about getting the platform for the new teeth.
So everybody, by the way, probably wants a fixed set of teeth.
Sure.
Okay. Like
Absolutely.
that woman in the photo and the photos you have, I mean, is that what they're requesting? Just, I mean, they want something that doesn't come in and out, obviously.
Yes. If you give them the options. Because some of them, again, they just don't know it exists. You mean we can actually attach it the same day? Yes. Oh.
So this
I didn't know we could do that.
concept is real.
It is real. We do it every week.
Is that
I mean,
right?
it's amazing. I mean, for me as a surgeon, it's changed my outlook on my career. I mean, I'm happier to go to work because you make people happy.
Really?
You make people happy.
Different than, I guess, what the typical oral surgery patient, right?
Yes.
They're in pain,
Yeah.
they're not so happy. But these people are eating and chewing and they're happy.
And it just changes their lives.
But you think the smile is important, though. I mean, all dentists that come on my program, they say, well, Randy, I think it's one of the most important things. What's your take on it? How important is the smile? Talking to the denture.
Smile?
Because there's a lot of dentures that don't smile because they hate their denture, you say.
They're missing out on the center of the face. I mean, look at Leonardo da Vinci and all the great masters, sculptors and painters starting hundreds of years ago. They all designed faces based upon beauty, and how they defined beauty was proportion. And the facial proportions are all dependent on teeth.
Okay.
Okay, so if you lose all your teeth, your mouth closes down, your lower lip comes up to your nose, and you look funny. That bitter beer taste commercial, okay? That's not an attractive person.
You know, in a tough economy, you know, I was thinking about this after our conversation on the telephone, and we employ people and I interview people, and one person was smiling and one person wasn't, and it seems like you want to hire the happy person with, you know, given the same backgrounds. And
the teeth make the difference. Okay, whether it's a job interview.
I'm laughing only because of, you know, this is your belief because of what you do.
It's first impression.
You're right, I guess.
I mean, it is the job interview. It's the meeting somebody else for the first time.
Okay.
Okay, whether you're 15 or 50, it's still a first date. Okay, so teeth are the center of the face. They define the proportions. They define beauty.
Are you ever surprised with the reactions the patients, you know, or the things that they do or tell you when it's all done?
Yes.
Like what?
It's funny. Okay, let me show you one more lady. This is Betsy.
All right.
Okay.
Now that's an attractive, sophisticated-looking woman.
Yes. She's a wonderful person, great personality. This is her after surgery.
Okay.
And this is a bigger smile than what she had. But here's the little, everybody has this one little different story. So Betsy comes in probably a week after surgery, and here's her, she goes, oh my gosh, here's the funniest thing. I went through the drive-thru the other day and I got my Diet Sprite and I started drinking it and I was like, oh my gosh, I forgot. And I was like, well, okay, did you not want the Diet Sprite? She goes, no, there was ice in my drink. And I forgot to say I don't want any ice. Now this point was totally lost on me.
Okay.
Why not have ice in your drink? Why is that different? You got to remember, she has not had anything that's been too hot or too cold for 27 years.
Because it hurt?
Because it hurt.
Interesting.
Okay? We've changed her life. She's now can enjoy all kinds of food. She always had pain somewhere. If she drank hot coffee, if she drank something cold, if she bit in the wrong place. And so when we finish her, she's like, what was I waiting for? That's really what that's the most unanimous thing. If I do an upper jaw and we do the upper teeth and we don't do the lower teeth, this happened, a lady came in from out of state last week.
All right.
She's so overwhelmed by the emotional attachment to her teeth, even though they're falling out, literally falling out of her head,
okay.
She can really only mentally grasp, let's just do the top ones, okay?
Okay.
The bottoms were just as in bad a shape. We did the top teeth, she woke up from surgery. What is the first thing she said?
What?
I should have done the lower ones. Because it took that process, and this is literally seconds after waking up. She woke up and she goes, oh my gosh.
Now all these people are sedated too. We should mention IV sedation.
Yes,
right?
I put them asleep in my office. Now what makes our office is set up uniquely. We function and we are a licensed and certified ambulatory surgery center.
So you're a surgery center?
Yes. It's not a dental office.
Okay.
There is a huge difference in what I'm required to do regulation-wise, construction.
So safety's big?
Safety's huge.
Yeah, because most people that are doing this in an office in their...
You know what it takes to have a dental office, right? You could do it in a cardboard box, as long as you put your name on the door.
Okay, this might be an exaggeration. Somebody will get mad and there'll be disclaimers. That's probably not true. Okay. But
no.
Basically a chair in a room that's clean and those things.
Right.
So you have a surgery center, but I told you on the phone, I said, but isn't that more expensive?
No.
To have a surgery center?
No.
Because you own the surgery center?
I own the surgery center. But what it allows me,
it allows other doctors do stuff in there.
Yes.
Okay.
But it allows me to control my environment and deliver the highest quality of safety.
Is it true they don't even remember the procedure? I mean, they walk in with no teeth. They walk out with a set of teeth.
It's
really?
almost like the happiest end to a dream. They
look in the mirror and see themselves with teeth?
Yes, they're smiling for the first time. They're walking out in the waiting room afterwards and they're seeing a spouse. They're seeing family for the first time with a big smile. And they even have bigger reactions.
Do they get emotional?
Yeah.
Really?
It's funny. Patients are usually crying.
I mean, this is how you get your kicks. You said you love to do this.
Love it.
Really?
Yeah.
So you're not too old. You say that like a woman like this. Now this is a beautiful smile, by the way.
Yes.
Woman
Great
like
job.
this. They don't come in and out. It's like having her teeth. Do you think her teeth are probably better than they've ever been, even when she was 18? I mean, just they're firm. They're set.
Yes. She actually, and a lot of patients do this, they bring in a picture from every 2 years growing up, and this is how my teeth looked until I was 18 or till I was 28. And when we design a new set, then it's even better than what they were planning on. This patient right here,
okay,
she came in, nice lady, her teeth actually looked really good. But here's what the problem was. She had one, show the inside here.
Yeah, oh boy, that doesn't.
So this is one long bridge and now it's loose. I mean, it's gone from missing one or two teeth to a longer bridge, and that bridge went bad and now it's a longer bridge and the whole thing's loose. So if she loses this, she's not gonna have any teeth to smile with.
Okay.
So what did she want to do? She wanted her teeth to look exactly like her daughter's.
All right.
So we kind of started with a blank canvas, made her teeth set up to shape like her daughter.
With dental implants.
Put the dental implants in, secured the teeth to it in the same day, and she walked out and she said, oh my gosh, I'm 30 years younger. I don't have any more pain. I don't have to worry about my teeth coming out.
So no more dentures. Okay, so we are
Yes.
out of time. Somebody watching this, and I want to say in the perfect scenario, okay, they're in their 70s, fairly healthy, they can walk into your office. If everything goes right, how soon from them watching this today can they actually have a fixed set of teeth in their mouth? If everything goes right. Perfect scenario. How fast? 2 weeks? A month?
Or less. I mean, they have a set of teeth in that they like.
So like 3 weeks from today, if they're watching
1
this.
week from today?
Really? Does that happen?
Yes.
Interesting.
If somebody comes in, here's the teeth, this is how I want them. They're dentures, I want them attached. In many cases, we can take those dentures and attach them as soon as they're ready for surgery.
And now what do they take for pain the next day?
That's the funny thing. Now, wouldn't this seem drastic, even if we're taking out all the teeth, replacing implants? Gosh, that's gotta hurt. I would say most of them, again, Felicia, she came in on a Saturday, and she went home back to work on Monday. I'm usually doing this on a Friday or Saturday. I have people going back to work on Monday. Professionals, you know, they're taking surprising little meds, and it's not that I'm surprised, it's that they're surprised. They're like, I really didn't take any.
Do some people just take like a Motrin or whatever?
I would say some of them don't even take the prescription medicine, they take over the counter, Tylenol or Motrin.
Okay.
And literally a day or so. Most of them are done with pain medicine after just a few days.
Okay, a recap, and we're out of time. I keep saying it, but we really are. A recap for denture wears. 2 implants.
Two implants.
You go through it quickly.
Absolutely. For denture wears, you can put 2 implants down here. Help hold in that loose lower denture.
Okay.
You can do 4.
All right.
But the best treatment, the absolute game changer, is put in 4 or more and fix the teeth to them that day.
So 4 can also be a fixed?
Yes.
Okay.
Absolutely. And nobody will ever regret that decision.
All on 4, you call it. Is
all
that
on
right?
4. Absolutely.
Gonna fix it. So no more dentures?
No more dentures.
Good. So how do they get an appointment? They just call your office?
They just call our office.
They'll get to meet with you?
They'll meet with me. They'll meet with my team. We'll even start taking the 3D x-rays to see how, you know, they're a candidate.
Yeah, how soon could they find out they're candidates for this all
If they come to the
procedure?
office, they need to come in for a consultation. We'll take the necessary x-rays, we'll do an exam, we'll review medical histories, we'll make sure that everything's ready to go. And we can usually tell them that day whether we can do it or not.
Okay, good. I want to thank you so much.
Thank you.
For coming on the show. Very interesting. Very
Appreciate
good,
it, Randy.
Good stuff. And all of this is on your website?
Yes.
Okay, good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you could go to our website at wellnesshour.com and just put in dental implants or Dallas dental implants, of course, or Dr. Wallace's name. For now, I wish you good health.